Hello everyone and welcome to this episode of Trust TV. I'm your host Memo Hea, and with us we have Dr. John Willardsen. Doctor, thanks for being here.
Thanks Memo, thanks for having me.
In today's video we're going to be reviewing a viewer's x-ray. We're going to be doing an online consultation. We get a lot of questions, we get a lot of x-rays sent in from all over the place. Dr. Willardsen, tell us what you see in this x-ray.
Okay, so this x-ray, the patient was inquiring on YouTube and had forwarded me this x-ray, basically saying, I've had implants, things are kind of falling apart, what do I do? Not uncommon. When I look at this x-ray, I see so much that's going on. He's got different brands of implants almost in every location. So right there, I know there was no continuity to the case. I'm not exactly sure the time frames. It's probably been over the last 20 years that he's had all this work done. So, it is what it is. But at the end of the day, I'll have to have the patient come in and do a good thorough examination, take x-rays of each implant, determine what implant is viable. Like, for example, if I have, there's a couple of implants here that I kind of question whether or not long-term they're going to be, viable. I've got an infection here at the top of this one. So there's just a lot of questions that I have. These have been exposed, meaning, there's probably a lot of food and debris because the covers that we normally put on top of the implant aren't there, so there's probably a lot of debris down inside each of these implants. So, I'd have the patient, I'm glad that he can send this to me and we can at least get this far, because at least now I have a starting point. I know what I'm dealing with. I know how to fix this, even without having seen the patient. I know exactly what I need to do to get his mouth squared away. There's just a few questions I would have is, okay, how many of these teeth am I going to save? What implants need to come out? And then, so little things like that. I know he's got sufficient bone to support the prosthesis or the teeth that I would diagnose for him or treatment plan for him. So, it's a great opportunity because he doesn't have to fly all the way out here. We can discuss, communicate, even discuss fees, sequencing, how many visits he needs, because he comes from back east as well. And so, how many visits it's going to take to finish this case. A lot of that information I can have help with. And so he can make the decision on whether or not he wants to move forward with trust implants or how he wants to proceed. But there's a lot going on here. He's got a lot of implants, a lot of which need to come out, some teeth that he still have that need to come out as well. So I like the idea of the patients sending in their x-rays, and at least at that that's a starting point. It's a good starting point for us, actually. And YouTube's been great that way because we've been able to get the information out there, they can get the information back to us, and then we can kind of start the dialogue and the conversation there. Because at the end of the day, he wants his teeth fixed, he wants this done. He wants to be able to come to one place, get it done, and be done with it. He did go to some other implant centers where they recommended taking out everything and doing an all-on-4 upper and lower. I highly do not recommend that. He's got plenty of bone to not do an all-on-4. So that's the other part of this is, they're going to get opinions from, you can go to 5 different offices and each one will give you a different opinion. And right now everybody's pushing the all-on-4. This case, I would not recommend that at all. It's just not even in the ballpark of proper diagnosis for this patient here. So
Okay, so this is one of many patients who are going through something like this, right? They've had work done before, they have some teeth, they have some implants. And you just mentioned that if someone goes to 4 different doctors, they're going to get 4 different opinions.
Yeah,
so
for sure.
What can our viewers do to prevent that or to get the correct procedure done in the mouth?
I'm not saying that I'm the only guy or going to give the most correct. I will give whatever my gut tells me the most ideal treatment according to every single patient that I see. So that I can guarantee, and I do have years and years of experience plus my background and training. So But somebody who does not come to Trust Implants, how can they ensure that they're getting the most ideal treatment? One, just looking at the background, training, history of the doctor, look at their before and afters, talk to patients who they've done work on. I mean, those are all good tools that a patient can use to ensure that they're getting the best treatment. A case like this, if you were to walk into, just a regular practice, most of them would not have a clue what to do with it because there's a lot of implants. There's a lot of different brands of implants. In fact, just having the proper screwdrivers to access these screws, to remove these crowns, to kind of start things, anew, that'll be a challenge for most practices out there. So,
Yeah.
For us, this is it's a slam dunk. It's very easy to do. But, at the end of the day, just making sure that the doctor has proper training and that they know what they're doing. That's really what the patients need to do. And, these corporate implant centers are all pushing the same thing, They're all pushing the all-on-4. And the fact that he was quoted to have an all-on-4 procedure done, looking at this x-ray just is mind-boggling to me because he's just not a candidate for that. He's got plenty of bone. I mean, he's got to have 8 implants and a fixed prosthesis is so much better than an all-on-4, plastic bridge, So,
Of course.
that's the only caution I would have for patients is these corporate all-on-4 centers. They put everybody in the same box, right? Everyone gets an all-on-4. That's what they've really fine-tuned that process and they've made it very streamlined for themselves, but it's not always the best thing for patients. And so, there is no, there's no magic, there's no dreams that go on that make the all-on-4 is the proper thing for every case. It's just not the case. So, doing your homework and making sure that they use good quality materials. Noble BioCare implants are a high quality, commercially pure grade 4 titanium implant is really important at the end of the day.
Yeah. I think what I got from what you said is, which can be a great solution is, let's say for a viewer like this, if you go to a center and you show them your x-ray and you ask the doctor, have you done work like this before? And because if they come here and they show you this x-ray, you can show a list of patients that you've done the exact same work.
Thousands of cases, yeah.
And so if I was a potential patient and I'm going through this, I'd say, wow, you've done this plenty of times. Right. But if I go to someone and they're like, we'll just do all-on-4, then maybe they don't really know what they're doing. So I think that could be a solution for them.
That's a good point, yeah.
Their track record, which is kind of what I got from this.
If they're only offering all-on-4, then at the end of the day, that's all they know how to do, and they're probably not the right place for you. If that's the only thing they're offering you, if they can't offer you, all-on-6 or sinus grafting or putting implants in the back of the jaw, they're not the right place. I mean, they learned how to do one procedure, and that's all they know how to do. So anything outside of that, they're stepping way outside their comfort zone because the all-on-4 was developed to kind of dumb down the procedure and put it in the hands of as many dentists as they possibly could, which it's done. But the ramifications and the complications that come along with that for patients who have spent all this time, effort, and money, it's huge. I say that because I see it every single day in my practice. I see the failures. I see the complications because, the ones that are working and that are fine, I don't see, but I see the ones that aren't working and are failing. So that's why I'm so passionate about this and passionate about patients getting what is best for them at the end of the day.
Of course. No, I couldn't agree with you more. And yeah, you see this all the time. Patients who come in, then also viewers who send in their x-rays every day. You're seeing this, failures. But Dr. Willardsen, thank you. Thank you for doing this online consultation and reviewing this. Thank you for sticking around and watching this episode of Trust TV. If you have any questions or any concerns, make sure you leave a comment or you can email us at info@trustimplants.com. And thanks for watching.